Good day everyone, my name is Julah Crispino, second year BPED student, and now I'm going to discuss about the topic, treadmill stress test.
What is treadmill stress test? Treadmill, an exercise device consisting of a continuous moving belt on which a person can walk or jog while remaining in one place. Treadmill exercise. A stress test. It uses the treadmill machine to monitor and record an individual's cardiovascular responses during a measured exercise.
So, here is the purposes of treadmill stress test.
To diagnose ischemic heart disease and investigate physiologic mechanism underlying cardiac symptoms of angina, arrhythmia, and functional value and competence.
To measure functional capacity for work, sports participation in rehabilitation program, or to estimate responses to medical or surgical treatments.
Now, let's proceed with the indication. Ang treadmill stress testing ay ipinapahiwatig para sa diagnosis at para sa awareness ng coronary artery disease. Ito ang paunang pagsisiyasat sa pagpili sa mga pasyente na may normal o malapit sa normal na resting ng ECG na may kakayahang magsagawa ng sapat na exercise. Indication for treadmill testing include symptoms suggesting myocardial ischemia, chest pain in patient excluded for acute coronary syndrome, recent ACS treated without coronary angiography or incomplete revascularization, known CAD with worsening symptoms, valvular heart disease, to assess exercise capacity and need for surgical intervention, newly diagnosed heart failure or cardiomyopathy, presumably healthy individuals without apparent heart disease who want to participate in sports or start a cardiovascular fitness exercise program should undergo this stress test. Ang mga malulusog na mga individual na walang maliwanag na sakit sa puso na gustong sumali sa mga sports o gustong magsimula ng isang cardiovascular fitness exercise ay dapat sumalalim sa stress test na ito. Hamaan, syempre, agud aware sanda sa state of health nanda, ag dayamanhay go sign nanda para ipadayon doan dang mga gustong obrahon such as participating in a sports or wanting to start a cardiovascular exercise. Cardiac patients who wants to participate in a rehabilitation program need this test. Ang mga pasyenteng mayroong inindang karamdaman sa puso na gustong sumali sa isang programa sa rehabilitasyon ay nangangailangan ng test na ito o kailangan nilang sumilalim sa test na ito. Kung mga programang rehabilitasyon it cardiac patients called cardiac rehabilitation hay makabulig it mabahog sa mga pasyente nga nga ma-improve doandang health ag ma-recover from heart attack. Iba pagid nga forms it heart disease or surgery nga magpamayad sanda. Kinahanglan nanda do treadmill stress test para aware sanda sa andang state it heart disease or condition agud sayud nanda kung alin mga exercise and education topics about cardiac or heart disease andang i-take. This is to be included in a yearly physical check-up for individuals above 40 years old and individual with ischemic heart disease. Ito ay isasama sa isang taunang pisikal na pagsusuri para sa mga individual na higit sa 40 taong gulang at mga individual na may ischemic heart disease. Makabulig do yearly check-up sa individuals above 40 years old nga i-monitor the state it andang health ag heart condition. Now, nagpahama ko it video about what is treadmill stress test para mas maintindihan ninyo it mayad kung alin gid man do ginahambal nga treadmill stress test.
A treadmill stress test, sometimes also called an exercise stress test, is used to evaluate a patient for heart rhythm abnormalities, sometimes called arrhythmias, to assess exercise tolerance or how much a patient can exercise, and sometimes it is used to assess coronary blood flow or the amount of blood flow that the heart muscle needs to have during exercise. First, the electrodes are placed on the patient's chest, and then those electrodes are connected to cables to allow the heart rhythm to be monitored. These electrodes and cables only monitor the heart rhythm. They do not cause any discomfort to the child. The cables are typically secured with a band to hold them in place, and then a mesh vest to allow the patient to run on the treadmill. After this, a blood pressure cuff is attached to the patient's arm, and at that time, the treadmill test is ready to start. The test is done while monitoring electrogram signals, blood pressure, and heart rate. The treadmill initially starts slowly and then gradually increases in both speed and incline to provide a challenging run. This test continues until the patient is tired, has reached a preset goal, or has specific findings on the test.
So, next is procedure.
Stress test should be performed 2 hours after a light meal with no butter, cream, coffee, tea, or alcohol.
The individual should dress appropriately for the exercise and wear comfortable walking shoes.
Why you should dress appropriately for this test? Mas mayad nga saktong clothes, dusok-suking itsang ka individual nga take it test, agud mas komportable sanda ag kalmado well doing the test. Mas makabulig kan dara nga mapadali do test ag makabuit mas insakto nga resulta. A resting electrocardiogram is taken before the stress exercise to monitor abnormalities of rhythm conduction and arrhythmia. Ang ECG ay isang medikal na pagsusuri na nakakakita ng mga problema sa puso sa pamamagitan ng pagsusukat sa electrical activity na nalilikha ng puso habang kumukontra ito. Ang isang doktor ay maaari rin magrekomenda ng ECG para sa mga taong nagpapakita ng mga sintomas tulad ng pananakit ng dibdib, paghinga, pagkahilo, pagkahimatay o mabilis o hindi regular na tibok ng puso. Ang ECG is a safe and non-invasive procedure with no known risk. The patient should rest at least 5 minutes before the stress exercise. Ang pasyente ay dapat magpahinga ng hindi bababa sa 5 minuto bago ang stress exercise. Bakit? Mas makakatulong sa kanila ang ilang minutong exercise na ito, makakatulong sa pasyente na maging kalmado at komportable bago ang test, nang gayon ay maayos ang maging daloy ng test at makakakuha ng insaktong resulta. Ang electrodes na para sa dibdib ay nakakabit sa dibdib ng pasyente at ang blood pressure ay i-check. Ang technician ay maglalagay ng 10 flat sticky patch na tinatawag ng electrode sa iyong dibdib. Ang mga patch na ito ay nakakabit sa isang ECG monitor na sumusunod sa electrical activity ng iyong puso sa oras ng test. The test ends after maintaining your target heart rate long enough to capture readings about the heart function, usually about 10 to 15 minutes. Ang iyong target na heart rate ay mas mataas kaysa kapag nagpapahinga. At batay na rin sa iyong edad at antas ng fitness. Do target nimo nga heart rate ay mas mataas kumpara sa kung nagapahuway ka. Kung nagahugag ka abihay or kung gahugag rusang ka tawo o may naubrang activity lalo na kapag intense hay nagaiba or nagadasig rather do heart rate it puso kaysa saga kung nagapahuway kagang kung siinhay uwa kait na ubra kaya kalmado do heart rate nimo. Kailangan subaybayan ka sa buong test. Kung magkakaroon ng problema, ihinto ka agad ng technician ng test. Napakahalaga para sa iyo na sabihin sa technician kung nakakaranas ka ng anumang mga sintomas tulad ng pananakit ng dibdib, pagkahilo, hindi pangkaraniwang igsi ng paghinga o matinding pagkapagod. Maaring tapusin ng maaga ng mga technician ang pagsusulit kung makakaranas ka ng malalang sintomas o humiling na huminto. Now, may sambato pagid akong napakagain nga video nga gin prepare para kinyo kung sinhay nagpakita sa video nga raro procedures or step 8 pag-perform it treadmill stress test.
Sometimes this part is more painful than the stress test.
Okay. Could you hold that for me?
Yeah.
Thank you, sir. Now,
far, so good.
Here we go. Now have you drop your left arm down again. Your calculated maximum heart rate is 146.
Okay.
Yeah, so you went over that, so it shows as red to let us know like you went over your target. So which is good. We would actually like patients to go for as long as they can, right?
Yeah. I've never finished the stage.
Okay. So let's try to do your best, okay?
Yeah.
Boom.
Another 10 seconds.
Another 10 seconds, okay. Work. Keep it up. Oh, we stop now. What do you think? Okay, let's stop now. Alright, here we go. Keep walking until it comes to a stop, okay? Good work, sir. Good work. Stay on the treadmill. Okay, I'm gonna get your blood pressure, okay? Drop your left arm down.
With each of the stage increases, we'd see something because it's quite a jump in workload,
Yeah.
and the body isn't usually.
Accustomed to it, right?
Yeah, exactly. But that's the purpose of the
The stress test, yeah.
Yeah. It wouldn't be a stress test if it wasn't
Yeah, it'd be
stressful.
stressful, right? Yeah.